The right guidance transforms every journey into a smoother experience. Hello, future pharmacists. Welcome to Elite Expertise, an online platform for your licensure needs, where your journey to becoming a successful pharmacist begins. Our mission is simple. We are dedicated to empowering you with the knowledge and skills you need to excel in your pharmacy career. At the heart of Elite Expertise are our visionary leaders, Mrs. Harika Bheemavarapu and Mr. Arief Mohammad. Both are accredited consultant.
ऑस्ट्रेलिया में काम करने का सपना है तो
The right guidance transforms every journey into a smoother experience. Hello, future pharmacists. Welcome to Elite Expertise, an online platform for your licensure needs, where your journey to becoming a successful pharmacist begins. Our mission is simple. We are dedicated to empowering you with the knowledge and skills you need to excel in your pharmacy career. At the heart of Elite Expertise are our visionary leaders, Mrs. Harika Bheemavarapu and Mr. Arief Mohammad. Both are accredited consultant pharmacists in Australia, bringing a wealth of knowledge and hands-on experience to our program. Their real-world expertise sets them apart, providing you with insights drawn from actual case studies that enrich your learning experience. Under their leadership, we offer a range of courses tailored to your needs. If you're aiming to practice in Australia, we provide comprehensive coaching for the KAPS and OPRA exams, as well as the Australian intern written and oral exams. For those looking to move to Canada, our PEBC exam preparation will set you on the path to success. And don't forget the PTE exam. Our dedicated resources will help you meet the language requirements needed for your journey. As the saying goes, success is not a destination, but a byproduct of hard work, time and energy devoted to your goals. At Elite Expertise, we believe that with dedication and effort, success will naturally follow. Our success is evidently shown in our results. In July 2023, 90% of our students cleared the KAPS exam, and in November, that number increased to 94%. By March 2024, over 94% students had passed, and in July, 95% students cleared. These results demonstrate that with hard work and the right guidance, you can achieve your goals. At Elite Expertise, our commitment goes beyond simply preparing you for licensure exams. We actively organise and engage in initiatives designed to foster your professional development. For instance, our Pharmacy Careers Summit 2024 provided a unique platform for you to connect with recruiters and explore job opportunities. Additionally, the Apticon event showcased the latest trends and innovations in the pharmacy sector, while our webinars held at various colleges offered invaluable insights, awareness, and networking opportunities. These events are a testament to our dedication to your growth and success. Our experienced educators are here to offer personalised support throughout your journey. At Elite Expertise, we believe in your potential and are dedicated to your success. Let's navigate your pharmacy path together and reach new heights. Join us at Elite Expertise today and turn your dreams into reality. Your future as a pharmacist starts here.
Hello, OPRA aspirants. I guess your exam preparation is going well. Now you got only last 10 more days to sit for the exam. And this 10 days is more important for you to crack this exam. So what you need to do, what are the tips and tricks that you need to follow for this 10 days to clear your examination? So I'm going to discuss all those things in this video. Let me explain about briefly our OPRA syllabus, the blueprint, and I will go through each topic and where you have to emphasize more. Okay. Hello, OPRA aspirants. I guess your exam preparation is going well. And so far you have spent at least 3-4 months for preparing for your exam. But now you got only last 10 more days to sit for the exam. And this 10 days is more important for you to crack this exam. So what you need to do, what are the tips and tricks that you need to follow for this 10 days to clear your examination? So I'm going to discuss all those things in this video. So the first thing is revision. So revision plays a most important role in this 10 days. So what will be the things that you have learned so far? So you must keep on revising every day. So each and every day, like you must keep on revising all the topics that you have learned. Okay? So let me explain about briefly our OPRA syllabus, the blueprint, and I will go through each topic and where you have to emphasize more. Okay. So the first thing, let's start with biomedical sciences. So in biomedical sciences, you have physiology, immunology, fluid electrolytes, and lab test values. So there are a lot of other topics also there, but these are the things that you need to focus more. Okay. So the first thing is your physiology, and then your immunology, from where you can expect at least 4 or 5 questions, and fluid electrolytes and lab test. Okay. So most of the students, they ignore these lab test values, okay, and fluid electrolytes and the imbalances, all these things that they try to ignore it, but these are the ones that also plays a major role. Then when it comes to the pharmaceutics, including the pharmacokinetics, calculations. So calculations plays a major role here. So you must keep on revising the calculations every day. You must do the calculations, revisions for both pharmacokinetic calculations as well as therapeutic calculations. So we know that the calculations, they are categorized into 2 types. One is the pharmacokinetic and the other is the simple dose-based calculations. So they all come under the therapeutic calculations. So don't ignore the calculations. So keep on practicing the calculations every day. Then when it comes to pharmacology and toxicology component, in pharmacology and toxicology, well, apart from revising all those common mechanism of actions of the drugs as well as the adverse effects and so on, so you must also focus mainly on the areas, okay, adverse drug effects and drug interactions. So drug interactions definitely plays a major role in the examination. So you can expect at least a few important things from the drug interactions, at least 4 or 5 questions from the drug interactions. And antidotes, there is another topic that is known as the antidotes. So don't ignore this part. Okay, so you must also focus on the antidotes, which are common antidotes for different drug toxicities. And when it comes to the other thing, like the factors that causing the pharmacokinetic changes in the body for the drugs, like what are the factors that affect mainly in case of pregnancy, in case of lactation, in case of geriatric patients, in elderly patients, as well as in pediatric patients, okay, how the pharmacokinetic changes that occurs. So these are the things that we need to focus more. Okay. Finally, when it comes to the therapeutics part, so therapeutics plays a major role here. Around 45% weightage is for the therapeutics. Okay. So therapeutics means like we'll study all the systems, like we'll study on the cardiovascular system, our nervous system, endocrine system, respiratory system, GIT, musculoskeletal, and all the other systems that we study, and we'll do all the MCQs in those things, and we'll focus more on those parts. But to crack the examination, apart from all these systems, so you must also focus on few other things which are included in your syllabus, like primary health care. So primary health care and the patient care. So these are the things that they have added in the OPRA examination. So you must focus even on that part as well. So you focus on the primary health care component and health promotion and drug harm minimization. So these are the few things, like they are the minor components, but definitely you will get the questions from these things. Okay? So you also focus on these components. Okay? So you make a proper planning for this exam for this last 10 days. Okay? And what will be the things that I have highlighted. So keep on revising these things for this last 10 days. And the most important thing, at this time, you should never ever try to open any new topics. Okay? So don't try to open or don't try to go through any new topics that you haven't learned so far, okay? Because it leads to cause a lot of mess up and a lot of confusion for you. So don't open any new topics. So what will be the things that you have learned for this last 3 months or for the last 4 months that you have been preparing for this OPRA examination? Just stay with those things and focus only on those things and revise all the things that you have learned. Okay? And for those who are giving the OPRA examination and those who are wondering like where can you find any free resources for this examination, so you guys can visit to our website, so Elite Expertise website, okay, so which is shown below. So you can visit to our website, and in our website we provide a lot of free resources for the exam preparation. Okay? So thank you so much and all the best for your examination. Just prepare well and rock this exam. Thank you.
Hello guys, good afternoon. I'm Ashrita, Admin Manager of Elite Expertise. I hope everyone is feeling good. Can I know how many are the students from Elite Expertise? Maybe you can just raise your hands in the chat box so that we can have a small interaction before the class gets, the official first orientation class gets started. Oh, there are many. Oh, nice. There are many of them who are already students of Elite Expertise. So some of them, they would have seen like how was you would have noticed how the last days of preparation would be there, right? Can someone unmute and just say how was the, feeling while just listening to all those, the last minute things and all? Or you want me to pick someone? Uh, um, Summer Muskan. When did you join Elite Expertise? Okay. I'm in November. You're joined. Maybe you can unmute yourself. That's okay.
Hi,
Hey, hi. When did you join Elite Expertise, dear?
I have joined 1 month ago.
Oh, how did you feel? Because last 1 month, ma'am was also teaching with the students, ma'am and sir were training the students who are writing the examination. So what were you feeling at that time?
Yeah, yeah, I was seeing those lectures, but I was following the recorded ones.
Okay. So what made you to choose Elite Expertise?
The experience of ma'am and sir.
How did you get to know about Elite Expertise, dear? Is it through Google or?
Yeah, from internet, YouTube.
Oh, that's so great. I hope you crack the exam in the first attempt. So this is an
Hope
official
so.
first orientation class. So we have Arief sir and Harika ma'am who will be taking the orientation session followed by a Q&A. So if you have any other queries, you can actually ask sir and ma'am. In the meanwhile, we'll just have a little introduction. We have Team Elite Expertise also in the call. So me, I'm the admin manager. So we have Srinija. Most of the students have spoke to her, I believe. We have Srinija, we have Glory, we have Ashtosh, who is a backend team. We have Shri, who is a main person. We have everyone on the team. Kripa, who is a CAPS qualified, again working. So you can find all the team members of Elite Expertise in this orientation as well. So we here as a big team supporting you, helping you to crack this examination in the first attempt. So I hope all your dreams come true. And second, who is that person who will tell their experience till now? How was it going? I would pick Prashanti Ravi. Are you a student of Elite Expertise? Have you joined you have joined through YouTube or just joined the session to just figure out what happens, what doesn't happen? Prashanti, are you there on the call? Just join. Oh, how did you get to know about Elite Expertise, Prashanti? You can unmute yourself. That's so great on Google. Are you from Telangana? Your name sounds so much like Telangana. Hello, is this live going to be from the beginning? Yes. Yes, it is. Okay. So, yes, it is. It's going to be live where Sir and Ma'am will be there. Living in Brisbane. Oh, that's so nice. You're from Australia. Even Sir and Ma'am are from Telangana and they're in Australia. So, that's very nice. Leela, is this a first class or you have joined or how did you get to know about your right expertise? Leela,
Hi, ma'am. Yeah, I'm here. Like, this is not my first class. I joined a month ago, but I have been just listening to the recorded video. I didn't join any live classes. But yeah, I'm definitely sure that all those resources were really useful.
yeah.
And I like the lecture, how ma'am and sir they are sharing their expertise, knowledge on the pharmacy. It's really great to look in their recorded videos. And I don't have to look any other resources. That's the best part.
Yeah, this is the major. Once you join and once you listen the lectures, you'll feel like you're learning pharmacy from ABC. All the fundamentals will be covered. They'll not teach you in such a way that they'll not just dust away their hands, but they'll teach in the point of view of while you actually do your internship. That time it will be very useful because sir and ma'am they'll also teach for intern oral, right? So both the
Yeah.
things are very very useful to you. Yeah, from which
Yeah.
country are you from, Leela?
I'm from Bhutan, but I'm in Australia right now.
How did you get to know about the light expertise?
Through my friends.
That's so nice. So we have got, you know, more of recommendations from the students.
Yeah.
That's so nice, Leela. Stay tuned, get to know about more.
All right.
Yeah. So we have Arief sir on board. Uh, Welcome Arief sir to the first ever session of orientation session of 2025 November batch. We have three quick questions from Team Elite Expertise before starting the session.
Thank you.
How
Thank you so much, Ashrita.
Yeah, we have three quick questions before the orientation starts. I know I'm not going to take too much time. So, how are you feeling again getting into the November batch? Just completed the July batch. It's just 2 days round the clock. So, how are you feeling, sir?
Yeah, of course, like this is as a ongoing process, like every time, like when one batch they finish their exam, then immediately we need to start for the next batch. So the next batch will be getting ready for to sit for their examination. So which means that like it will never end. Okay, it will start one by one, like every time it will be ongoing. But from every batch, like we keep on making some modifications for each batch. Okay, according to the change of the syllabus and according to mainly the clinical guidelines. Like as we are in the medical field, it never remains constant. Okay, so every day, like new inventions will be going on and new things will be coming up in the market, and we need to remain updated. And at the same time, we need to incorporate all those new things in our lectures.
Yeah.
So for every batch, it is like a bit challenging one. Okay, so teaching every batch is nothing but, again, we are teaching from, like, at first we need to learn from the basics, and again we need to give our best so that the students, they will perform their best in the examination.
And second question is, we have got the exceptional results for intern oral return. Like most of our KAPS, KAPS or OPRA candidates, they are our intern return. Even the outsiders were there. So Team Elite Expert is very happy on behalf of every team member. The backend team, I congratulate you for that, sir. So how do you train the OPRA and the interns? It's a similar or it would be a different thing?
No. While teaching for the interns is completely different, okay? Because in intern, there will be two exams, which will be, one is the intern written examination and the intern pharmacist oral examination. So like what we learn in the OPRA examination is just the basic things, but what we learn mainly in the intern examination is completely about application things. Okay, so in detail, we need to learn more about how the Australian practice it is. Okay, so those are the things that we learn more during the intern examinations. And I can say that when it comes to the intern examination, especially the oral examination is much challenging for the candidates, because like as overseas candidates, as those who have studied in India or wherever it is, okay,
Yeah.
so all over the world, like India, Nepal, or Pakistan, Sri Lanka, wherever it is they have studied, like they have a lot of like one thing is like in all these countries we don't have a proper like examination process for getting the license. Okay, so once we finish we graduate from the university, then immediately we'll get registered as a pharmacist and we start practicing as a pharmacist. But here in Western countries it is completely different. In Western countries, like even in Australia, those who have studied, local students, Aussies, okay, those who have studied in Australia, even they have to sit for the intern, written, and the oral examination. Okay, even they have to pass those examinations. Okay?
Yeah,
So that's how the difference it is between overseas candidates and those who have done the graduation here in Australia. So there will be a huge gap, especially when it comes to the oral examination, because in oral examination there will be 2 or 3 examiners. Okay,
Yeah.
and we need to sit in front of them and we need to do like how it is just like an interview session. Okay, so in
Viva,
a
it's
similar
just like
way,
a P-form Viva, sir.
yeah, it is just like a Viva, but it will be like more in detail. So B
Okay.
form Viva in the sense like we have the confidence, like definitely everyone will pass. Okay,
Yes.
in B form or in the Form D in India, those who are studying, everyone will pass. So if there are 100 students enrolled in the batch, all the 100 will pass. But
Yeah.
here that's not the case. Okay, so it will be a bit difficult task. So we have to train in that angle, in that way, so that they can easily crack these examinations.
Last question, sir. Last time we have seen more than 300 hours of lectures. Drain, drain, drain. This time also it will be like that?
Of course, like every batch, it will be like more than 300 plus of hours of lecture. So for the last batch of July OPRA, it went up to 350 to almost around 400 hours. Okay?
Oh my goodness.
So the reason why we are spending that much hours with the students is, so it is not like if you compare with other institutes, so what they do is just they will finish all the syllabus like in 50 hours or in 50 lectures, okay, and then they'll say that everything is done. Okay?
Yeah.
But here at Elite Expertise, the way that we teach is we train the students right from the basics. Okay, so at first they have to learn all the basics first. For the first 2 months, we spend the time only in teaching them the basics, and then we'll move on towards teaching them the concepts. Okay, and then we move on towards the application side, while they need to solve the MCQs, they need to solve the cases, and so on. Okay, so for that, definitely it needs time. Okay, so we can't go jump straight away to the application part. We can't straight away jump and show them the MCQ. Okay, this is the MCQ. If you get this MCQ, then this is the answer. So that's not the appropriate way of teaching. So first we need to teach all the basics, and then only we must move on to further session. Okay.
Yeah.
So that's why at Elite Expertise, even any batch that you take, so for all the batches, like it will be minimum 300 plus hours, like 350, sometimes 400 hours of training is required.
How much
So
percentage
that's
are you
how
expecting this time?
definitely it will be 90 plus. It will be 90 plus. Even the July batch students, those who have done recently, so as after they finish the examination, they will send the messages in the group. Okay,
Yes.
so everyone, based on like how they are replying, like based on their performance. Okay, so definitely I'm expecting like more than 90 plus this time.
Yes, sir. Without further ado, the stage is yours. The Zoom is yours now. Let's have Arief sir with the session now. Over to you, Arief sir.
Okay, thank you so much, Ashrita. So, well, guys, first of all, I would like to welcome everyone. So all of you for joining this orientation session. So I'll quickly share a slide with you. Well, I hope everyone can see this presentation, the slide, which is up over here. So first of all, I would like to welcome all the candidates for joining this orientation session. Okay. So, and today, that is on 18th of July, we are doing the first orientation, means officially we are going to start our course for November examination. Okay. So we are going to start our preparation for the November batch. So those who are completely new, and if you have just joined this session to know who we are and how we train for the candidates. So we at Elite Expertise, so we are an Australian-based company. We are mainly located in Melbourne, Australia, and we provide the training for Australian examinations. So the first part of the examination is the OPRA exam, and then the next part of the examinations to clear after OPRA examination will be Australian intern pharmacist exam and intern pharmacist written and the oral examination. Okay. So both myself and Mrs. Harika Bheemavarapu, we both are the trainers here. I'm a clinical pharmacist and also I'm a consultant pharmacist in Australia. So I'm working in Northern Health Hospital in Melbourne, and Mrs. Harika, she's also a clinical pharmacist and a consultant pharmacist. So she's working in Monash Health in Melbourne. So we both are practicing clinical pharmacists working in the hospitals in Australia. And these are the courses that we offer. The old version was the KAPS, but now it is OPRA examination. So we provide the training for the OPRA and then training for the intern pharmacist written and the intern pharmacist oral examination. And we also provide the training for the PVC for Canada and also PSI for Ireland. Okay. So these are the current trainings or the courses that we are offering to overseas pharmacists, those who are planning to become a pharmacist in these countries, like in Australia, New Zealand, Ireland, and in Canada. And when it comes to the success rate at Elite Expertise, we started Elite Expertise back in 2023, and July was our first batch. And in first batch of July, like we got 90%, and November 2023 was the second batch, again 94%. And in March 2024, 121 plus candidates, they have cleared the exam from Elite Expertise with a percentage of 93 to 94. And this is the result of July 2024. Okay. Again, like 140 candidates, they have cleared the examination. And this is the latest result of OPRA examination. The OPRA, that is in the March OPRA. So in the March OPRA, we got 90% of the success rate. And even this batch, that is the July batch, we are expecting the same from our students. Okay. So they just gave the examination this week. And we are just waiting for the results. So it takes at least like 2 to 3 weeks time to get the result. And we are expecting the same, like more than 90% of results in the coming July examination result. Okay. And what after this OPRA examination, like at Elite Expertise, we also provide the training for our intern pharmacist, that is intern pharmacist written and intern pharmacist oral examination. So far, there are more than 100 candidates, those who have cleared the intern pharmacist exams, both the written examination and oral examination from Elite Expertise. And now they are officially registered pharmacists in Australia. So they all are officially registered pharmacists. Okay. So, and currently there are 100 plus students who are enrolled with us in internship. So which means that they are getting the training for intern written and for the intern oral examination. Then now coming to the OPRA exam, which is going to be held for this November 2025. So here I'm going to discuss about the OPRA exam syllabus, and then the OPRA examination pattern, exam pattern, then the passing score, Then what are the main strategies for preparation? Then I'll also go through about the elite expertise mocks and the handouts that we provide and assignments, and there are some team push activities, so that I'm going to discuss it with you now. Okay, so these are all the things that we are going to discuss now. So first, let's begin with the OPRA exam syllabus. Okay. So when it comes to the OPRA exam syllabus, if you go to the official website of APC, there you can see the complete exam blueprint. Okay. So where they have mentioned in detail about what is the main content that is covered in the OPRA examination. So it will have biomedical sciences up to 20%, and medicinal chemistry and biopharmaceutics 10%, pharmacokinetics and pharmacodynamics, that is 10%, pharmacology and toxicology 15%, and therapeutics and patient care 45%. Okay. So these are the different components in which like each percentage of the scoring or the percentage weightage will be provided. Okay. So in detail, when we look at the content, like when we look at the complete syllabus of the OPRA examination, so the complete syllabus, it has got, or before we look at the OPRA examination syllabus, like how we get the questions in the OPRA examination. So when it comes to the OPRA examination questions, so they categorize the questions into 3 different levels. Okay. So what are the 3 different levels? The first level is recall or remembering questions. Okay. So these are nothing but the quite easy level of the questions. Okay. So where they will ask you what is the main side effect of amlodipine, and they will give you 4 options. Okay. Headache and some other 3 options. So where by looking at the option itself, you can easily identify that, okay, headache is the one of the common side effect of amlodipine. Okay. So these are nothing but the recall based questions. Okay, low level or the easy level questions. So up to 55% of the questions will be this recall based questions. Then the next level is comprehensive level. Up to 30% of the questions will be comprehensive level, where you need to think a lot before you give the answer. Okay. The questions won't be straightforward. Okay. So they will twist the questions. Okay. The concept, it remains the same, but they will twist the questions, but you need to think a lot up over there. And 15% will be completely application based. Application based in the sense where you need to think more about it. Okay. Like sometimes they will also give the short case scenario, and then there will be 5 questions related to that case scenario. Okay, so you need to think a lot to answer those questions. So which means that the 45% of the questions, okay, so you have to like they are not the straightforward questions. We have to think a lot to give the answer. Okay. So for this, what's the strategy that we follow at the Elite Expertise? Okay, so we not only train you just by providing the recall based questions. Okay, recall in the sense like the simple straightforward questions. We mainly teach you based on clinical case studies. Okay. So while we keep on providing you more and more of the case scenarios, okay, and with those case scenarios, you will learn in your classes. So this is how that we teach. At first, we will go through all the basic syllabus, and then we'll focus mainly on the case scenarios or the case studies. Even while teaching the regular classes, the basic syllabus also will keep on emphasizing on the case studies or the case scenarios through which we learn more from them. Okay. Then here is the complete syllabus from the official website of the APC. Okay, if you look at the official website of the APC, then you will find this syllabus. In the biomedical sciences, you will have the physiological process and normal body functions for all the systems like CNS, digestive, cardiovascular, lymphatic, nervous system. And in pathophysiology, again, you will have this component. In microbiology, you will have this component. Okay. Immunology, you will have this part. And then disorders of the body fluids, fluid and electrolyte imbalances, okay, and the symptoms of disorders, okay, signs and symptoms of different disease, and the diagnostic test or the laboratory test. So, like, which means that here, in order to prepare for this biomedical sciences, only for 20% of the biomedical sciences, so we have to go through physiology textbook, we have to go through the pathophysiology textbook, we have to go through microbiology textbook, we have to go through the immunology textbook, we have to go through electrolytes, lab and electrolyte values, okay, and then we also have to go through certain fluid and electrolytes, and also the laboratory investigations and all those things. Okay, so these are the whole things that we need to study just to score this 20% of the biomedical sciences. Okay? Then when it comes to the medicinal chemistry and biopharmaceutics. So in medicinal chemistry and biopharmaceutics, the main topics that are involved are physicochemical properties, okay, like absorption, distribution, metabolism, and excretion, then formulation of different drug delivery systems like solids, liquids, that is tablets, capsules, suspensions, emulsions, their formulation, and drug stability and solubility. What are the main factors that are involved for the drug solubility, then drug formulation, pharmaceutical microbiology. Okay. So all these things we need to study like different textbooks in order to get only 10% of weightage. Okay. Then when it comes to the pharmacokinetics and dynamics, then drug metabolism, principles of pharmacokinetics, factors affecting the drug impact, evaluation of pharmacokinetic data in treating the patient, then drug metabolism, all these things will cover only 10%. Okay. And finally, sorry. Okay. And we also have the pharmacology and toxicology component. From pharmacology and toxicology, like again, a huge thing is involved. Okay. So finally, from therapeutics and patient care. From therapeutics and patient care, we have the different screening methodologies and dose calculations, primary healthcare, safe and effective use of medicines, where you also have the monitoring parameters and the harm minimization, health promotion, confidentiality. So all these things we need to cover we need to study to clear the examination. Okay, so which means that there is a huge syllabus. Okay, when you look at the syllabus, at least you need to have 10 or 15 different standard textbooks aside. Okay, so if any candidate is preparing, then they must have 10 or 15 standard textbooks aside to study all this huge syllabus. Okay, so but at Elite Expertise, the thing is that you need not to study any other textbooks. You need not to study anything. Okay, because what we are doing is we will prepare all our material. Okay, so based on the things, we will refer all the standard textbooks, we'll refer all the standard guidelines, we will refer the AMH, therapeutic guidelines, and all the other standard textbooks, and we prepare all our material for you guys, so that you need not to open any other resources. Okay, so what will be the content that we provide to you? So just you need to follow our lectures, and just you need to follow our handouts, and just you need to follow our what we say, our mocks, okay, and assignments. So those things, if you follow, then that's more than enough. Okay, so if we keep on studying all these things, okay, then even 2 years time will not be sufficient to cover. Okay, so these are the things that we need to keep in consideration while preparing. Okay, so this is the blueprint from official APC website. So what is the passing score for OPRA examination? When it comes to the passing score, guys, there is no passing percentage. Okay, so one thing that we need to keep in consideration is there is no particular passing percentage for this OPRA examination. So the methodology what they follow here is it is completely based on the RASH methodology, or we can say that's the scale scoring system. So which means that, for example, if there are two candidates, they are giving the examination. So one candidate gave the examination in New Delhi and the other candidate gave the examination in Melbourne. Okay, so both they will get different set of papers. Okay, even though they give the examination on the same day, okay, both they will get different set of papers. Now, when it comes to the scale scoring system, how it applies is, so your passing rate, it depends on how you perform in your individual paper. Okay, for example, there are two friends, friend A and B, person A and B. Okay. Person A, he has got 83% scoring in the OPRA examination, and person B has got only 80% scoring in the OPRA examination. Now, person B, who got only 80, he might pass the examination, and person A, who got 83, he might fail the exam. Okay. The reason here is because, as I mentioned, that it is a scale scoring. Okay, and it is mainly, the scoring is completely dependent on individual exam, like individual paper. Okay, so which means that the person A who has got 83%, actually he need to get up to 85% to pass that particular paper. Okay, because the set of paper he got is a bit easy when compared to the other person. Okay, so that's why he need to score not 83, but he need to score 85 in order to clear that paper. So in this way, in OPRA examination, there is no particular passing score. So your scoring completely depends on your performance in that particular set of paper. Okay. And when it comes to the teaching methodology, guys, so as here at Elite Expertise, we follow like total, as I mentioned that at the beginning itself, we spend at least 350 to 400 hours per batch for each batch. Okay. And each batch we target for 3.5 months. And in this 3.5 months, for the first 2.5 months, we will finish all our core syllabus. Okay? So our core syllabus will be done in the first 2.5 months, and the last 1 month, that is the most essential for all the candidates. Okay, so in this last 1 month, we'll do revisions. We'll do revisions. We'll keep on discussing a lot of MCQs. Okay, so we'll make you get exposed to clinical case studies and how to solve the MCQs and so on. So that last 1 month, it plays a critical role. So that's why most of the for most of the candidates, we ask to take day offs from the workplace. Okay, because like 90% or 95% of all the candidates who are preparing for this OPRA examination, they are working professionals. Okay, so we ask them to take the day offs like 1 month before the examination. Okay, so that they can focus mainly on exam. Okay, and also wherever it is possible, we'll keep on giving the assignments for all the major topics. Like once I finish one major system like respiratory system, teaching respiratory system, then I will give one assignment. Then once I finish the cardiovascular system, then I will provide you one assignment. Then nervous system, again one assignment. Okay, and apart from this assignment, you also have mocks. Okay, in ProProfs, where you need to do the mocks, and also you need to keep on doing the other activities. Okay, so this is our weekly planner. This is the rough planner. Okay, so week 1 we'll do the introduction and the basic pharmacology, then we'll start the respiratory system, and then we'll start the cardiovascular system. In week 3 and week 4, then we'll move on to the pharmacokinetics, then pharmacodynamics, and then we'll start the nervous system, that is the central nervous system, then infectious diseases, cancer chemotherapy, musculoskeletal system, endocrine system. So which means that by week 10, that is 2.5 months, we will finish all the core syllabus, okay, discussing all the core syllabus. Okay, then from week 11, that is for the last 1 month, week 11, week 12, 13, and 14. So what we will do is we'll focus mainly on the MCQs. Okay, and we'll keep on asking you to keep doing the mocks, which are available on the ProProfs, and you need to keep on doing the assignments and involving the team push activities. So all these are the ones that you need to keep on doing from week 11 to week 14. Means week 11 to week 14 is completely revision classes. Okay? And the timings for week 11 will start roughly around 12:30 p.m. Australian time, and the classes will be going on till night 9 p.m. Okay, but there will be appropriate breaks, don't worry. So with appropriate breaks for every 2 hours, we'll keep on giving the breaks for you, and then the classes will keep on going till night 9 p.m. Okay, so that's how we will train you for the last 4 weeks. Okay, so this last 4 weeks will make you to keep on, like, we will never leave you until the last day. In case like if the examination is on Monday, okay, till Saturday evening, so we will be with you. We'll be keep on taking the classes in the sense, not new topics, already discussed topics, but we'll do a revisions. Okay, so till Saturday we'll be with you. We'll keep on taking the classes, we'll keep on doing the revisions. Okay, and on Monday you will go and sit for the examination. Okay, so this is the planner for preparation. And when it comes to the strategies for clearing this examination, OPRA exam, so the main strategy is we request all the candidates to attend the live classes. Okay, so weekly, initially there will be 3 live classes per week, on Wednesdays, on Friday, and on Saturday. But as the examination it comes a bit closer, then we'll increase the number of hours. Okay, at the beginning, like for the first 4 weeks, you will be having the classes only for 3 days per week. Okay, but later on it will increase to 4 days per week, then 5 days per week. But as I mentioned, that 1 month before the examination, every day. Okay, on Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, okay, from morning, that is afternoon 12 p.m. to night 9 p.m. Australian timing. So you'll be having the classes. Okay. So try to attend the live classes. If you miss to attend the live class, okay, so at Elect Expertise, we also have the opportunity of going through the recorded lectures. Okay. So for example, if you are working and if you can't make the class, if you can't make to attend the live lecture, then you can also attend the recorded version. Okay, you can also watch that recorded version and at least try to attend one or two live classes which are going on over the week. Okay, so which means that during that live classes you can ask any questions that you have, okay, any doubts, and you can clarify your doubts. Okay. And we also provide the pre-recorded modules. Okay. So for some topics, I will give you the pre-recorded modules, which means that you need to go through that pre-recorded module first, and then you need to attend the live class. And in the live class, I will quickly revise the topic once again, and then we'll keep on doing the MCQs. Then you have to complete your assignments. I'll keep on providing you the assignments, and you must keep on doing those assignments, okay, on time. And need to do the mocks. Mocks plays a major role here. Okay, and like for mocks, there is a special platform that is the ProProfs. So where you need to keep on doing the mocks there, and quickly refer the information which is provided in the handouts. We'll also provide the handouts. Okay, so once the lecture is done, then quickly go through the handouts before you do the mock or the grand test. Okay? And also participate in the team push activities. So these are the main strategies that you need to follow in order to clear the OPRA examination in your first attempt. Okay? And when it comes to the references, guys, like as I mentioned that as we have just now, we have seen about the syllabus for OPRA examination. When you look at the syllabus, like just for biomedical sciences itself, at least you have to refer 4 or 5 textbooks, okay, just to clear the 20% of the biomedical science subjects. You have to refer 4 or 5 textbooks. Okay, so but if you are with Elite Expertise, you need not to worry about all those things. Okay, so because all the material that we prepare, okay, we do everything for you. Okay, so we refer everything, all the standard textbooks, all the guidelines, AMH, therapeutic guideline, and up to date, everything that we refer, and we will prepare the content for you, which means that you need not to open any other resources, okay, or any other references. Okay, so just you need to follow whatever be the things that we teach in the class, and just need to keep on doing the mocks and assignments and so on. Okay. And when it comes to the assignment, like we'll keep on giving the assignment, we'll provide you a topic either on the cardiovascular system or nervous system. So for assignment, just you need to give the answer. Like there will be a statement or a question. For that question, you need to give the answer just in one single word or one or in 2 words. Okay? You need not write a big essays. So just in 1 or 2 words, just you need to give the answer. Okay? And for all these assignments, during my live class, okay, again, I will discuss the answers for all the assignment questions. And ProProfs. So don't forget that all your mocks, your practice tests, they will be on a special platform, which is known as the ProProfs. So you need to go and do your mocks on ProProfs. Okay, and our team members are available. Always they will be available for you. So if you have any issues, then just you need to put a message in the WhatsApp group. Okay, then one of the team members, they will respond. And if you have any issues with the ProProfs or any issue with the Elite Expertise app or anything, so just you need to keep a message in the group, and one of the team members, they will respond and they will rectify it as soon as possible. Okay, so these are the things, guys, that you need to follow and that you need to do in order to crack the OPRA examination in the first attempt. Okay, so do remember, always, like we are not going to, when we look at the syllabus, it looks like huge syllabus and a vast syllabus, but what we are going to do is we are extracting only 20% from that. Okay, only 20%. 20% means this 20% is the important one, the essential one. Okay, so we will take only that 20% and we will focus mainly on that 20%, means which is essential or which is important for the examination. Okay, so out of the whole syllabus, the vast syllabus, okay, if you read all that syllabus, okay, so like it takes at least 2 years time to finish all those textbooks. So we need not to do that method. So always remember, so whatever the thing that we are following, only 20% will be the most important ones, and we are with you to provide you that 20% which is important for the examination. Okay, so you need to spend 80% of your time on this 20% of the topics. Okay, so that's it from myself. I'll pass it over to Ashrita.
Yes, sir. Next, we'll be having Harika ma'am within few minutes, isn't it, sir?
Yeah, exactly.
Yeah. In the meantime, if you have any questions, you can ask me. The chat box is open. Before ma'am comes and she takes over. So any questions, any concerns, till now you can actually comment in the comment section. The chat box is open. What is team push activities? You'll get to know it summer. You'll be divided into teams. They'll be giving you some assignments. The team will be giving you an 3 months. Very nice. 3 months are enough. Yes, it's absolutely enough. We have many students who have just passed exam in 1 month. 60-year-old, she has passed within 3 months. If they all can do, Ashya can also do. Yeah. So sir will say 20% it's more important, but sir will make sure like all the topics which are very, very, very important. Like it doesn't mean that others are not important, but they'll teach you in such a way that you'll have immense knowledge. If the knowledge is there, you can pass the examinations just like that, right? So those are all done. Apart from live lecture, how much time we have to give for the preparation? So the correct person is ma'am and sir. They will answer this question and keep this. But usually we say the students, before 1 month, we ask them 15 to 20 days. We ask them to take leaves so that they can invest whole time and whole day in it. Sheikh Saida Islam, after cracking the exam, what's the process to get into internship? So you need to pass OPRA exam first. After that, APRA registration needs to be done. Then you can get an EOI. Once the EOI is done, you need to get a visa. Once you get a visa, you need to. Hello, ma'am. So over to Harika, ma'am. Harika, ma'am is a working clinical pharmacist in Monash. I guess today you had a hospital, ma'am. You had work.
Yes, yes, yes.
Yeah. Over to you, ma'am.
Yeah, sure. 1 second, guys.
Okay.
Just loading. Thank you, Ashrita, for offering it to me. Hello, guys. I'm Harika, one of your teachers. I'm a consultant pharmacist working for a public health hospital in Victoria. I'm still loading my PowerPoint, sorry. Yeah, so we have, how many minimum hours do we need to study per day? Is that a question? Okay, I'll answer your question, don't worry. Okay, so basically, I'll start from the beginning. We had a group for the July pupil, like July exam has finished 2 days ago, and that's why you have the orientation today. So how it works is actually the group, I think, saw minimum like 5,000, 6,000 plus messages of people, chatting and like talking about, how to prepare and all that. And then another group is silent because they've given the exam and they are waiting for their result. So, well, how much time you to study, how to study, why to study, when to study, what to study. So I will tell all that first because this is an orientation session. First of all, you listen to the lessons. Okay, so comprehensively, everything you need is covered in the lessons. Which topic should we cover first? Okay, so first of all, okay, I'll just, hi, how are you, Kavya? Good to see you, dear. So what to cover, which topics to cover, leave all that. First, listen to me. So in the lesson, you will be taught A, B, C, D till the advanced therapeutics and patient care. Okay, so we'll start with very basics. We'll go very slow when teaching the basics. Basics therapy, basics of the pharmacology, autonomic pharmacology, toxicology, therapeutics, patient care will be done in very much detail in a slow pace. And then you will be, once you get that knowledge, you will be taken into higher standards of cardiovascular, renal, nephrology related topics and neurovascular, and mainly neurology. Central nervous system is a challenge. So you'll be taken into those topics, and then I will kick in, and then I will like teach you kinetics, which is the most confusing part for you. And we will go for calculations, and then we will do the patient care questions as well. So this is normally the methodology, like how the classes go. So what you have to do, how many hours you have to study, leave all that. Listen to the lesson as if you're listening to a story. That's the first point to clear the exam in first attempt. Okay, so you have seen, our alumni will tell you in their interviews very shortly, we are going to get a massive success for OPRA July as well, just like how 65 people passed for, 65 plus students have passed for March OPRA, the very first OPRA exam it was. And this time we have received an overwhelming response. Our students are going to make it, make us proud. We are confident about it. And then we had a KAPS success rate of 1,000 plus students who have cleared under us. And from our hands, we've got hundreds of interns who have cleared their written and oral exams in Australia. So all of them agree to one point, listening to the lessons very carefully. Okay, so the lessons would never be boring. They'll be very interesting to you. You listen to the lesson as if you're listening to the story. Okay, in a detailed manner. Slowly listen to the session. Mostly try to attend the live class. If you can't, the same lecture goes into the recorded as well. You can attend it in a very slow manner. Okay, you don't know, you never know from which corner the question comes. So lesson has to be done in very much detail. When you are learning something, a concept in the lesson, you have to learn as if you are going to be that healthcare professional facing the patient. Okay, so the difference between you and us is we have practice here. Of course, I think almost 7+ years of practice here. So what we are going to give you, what sir and I are going to give you is that years of practice, like what we learned. And then I will show you an example also how questions are asked and why that's important. So years of practice, learn from someone's experience. So, and the second thing is, if a junior doctor reads a book, how to do a surgery, how to remove gallbladder, okay, will he be able to perform a surgery? No, he can't. He has to see how a senior doctor is doing it, and then he can do it. Okay, so you need a physical, practical experience. And for that, you need examples. Examples of what happens in a daily life of a pharmacist in Australia. Okay, how things can get affected, how you can get into trouble when you're practicing here, how your license is very important to you, what is APRA, what is the APRA license, and how it is how a healthcare practitioner has highest standards. It's like a gold standard here, where we have to have highest levels of public trust. Okay, so all this is what you learn from our experiences. So we do what is called as depiction of examples from our everyday life. So learn from the lessons. So you listen to the lesson first time in a very detailed manner. Don't write any notes. If you end up writing notes, you will write even something like if I cough, you will write coughed. Don't write any notes. Notes making is an art, and it doesn't come in first instance. And when you're writing the notes, you're going to waste your time. The second and third time, listen to the same lesson at a higher speed in your app. Okay, you don't need to do notes making here also, but if you listen to a lesson second and third time, you will understand what is important, what is not. The notes making should be very small. Your notes should be very small, like hardly one paper. Okay, you don't make a big PhD book. Again, we are not doing PhDs here. We are learning the patient care. And the mock tests. You have a ProPros platform where the mock tests are delivered to you. Apart from that, before the exam, I think 3 weeks before the exam, 3 weeks before the exam, you'll have minimum 2,000 plus questions which are discussed, and cases which are discussed, real life cases in the classes. Okay, showing you the examples of how to improve your knowledge. So you're going to participate in those discussions. So doing the lectures and mock tests, how you're going to do the lecture, how many hours you're going to sit with the lecture, that's your choice. I will say I studied 18 hours, I studied 16 hours, I studied 15 hours. That's not the point. You do cooking, you do cleaning, you play with your children, you just watch the lectures again and again, because you never know from which corner the question comes. And then doing the mock test multiple times will give you the real life experience, like how you're answering the questions. Sometimes when you do the mocks, first you give the answer. You can do any mock right now because you're all pharmacists, you're all bachelors in pharmacy or masters or pharmacies. You can do any mock question. Okay, you can do any mock question. Of course, your score will not be good. 100%. Now, if you do a mock, you will hardly score some 20% marks, but your score will start improving 3 weeks before the exam. And when you do a mock and make a mistake in the mock, and then suddenly somehow one of your teachers explains that in the class, you will never forget it. Like normally when we copy something, we never forget it. Okay, when we cheat something, we never forget. And then when we remember the mock, we remember our mistakes. We never forget our mistakes. So this is the way of learning. Don't try to memorize the syllabus. Don't run after the syllabus. Stick to what your teachers are training you. Okay. No textbook, no material, no Google, no ChatGPT. We don't allow anything in our team. If you are a part of WhatsApp group, you'll know how strictly nothing is allowed here in Elite Expertise, only the lessons. Or because we are studying and teaching you from all the standard books in the world, from the renal drug databases, Australian Medication Handbook, therapeutic guidelines, BMG breast practice guidelines. We have up-to-date guidelines. We are doing the learning. You don't have to do the learning from reading the books. You will take like 2-3 years just to finish one book. Okay, we are doing that. Just take that information, which is cooked food. Okay, just consume it raw. You don't have to start cutting the vegetables and like frying them and seasoning them. You have a cooked food ready in the form of lectures. You got to watch the lectures. This much, you don't be lazy. One guy, I think randomly, I want everything in material, nothing in lessons. So if you want material, even Google will give you, ChatGPT will give you 100 materials. So mainly lectures, because you will learn from the real life practice by listening to the lectures. How will you listen? How many hours you listen? I don't care, but all the lectures, minimum 100 lectures would be there in every batch, and they should be finished at least 3 times if you want to become a best pharmacist. Okay, and then doing the mock test will give you that real life practice, how to answer the question, and you will clear the exam. Just these 2 points. The handouts which we provide are to be used only for summarizing, nothing, and don't rely too much on your memory. Memory is not something, everyone has good memory. Okay, we all remember our names, our father name, mother name, everyone's name. So we have that basic memory. It's about knowledge, and memory is not the sole factor for this exam. Memorizing things is not the sole factor. It's the application which matters. Okay, so it's the knowledge which you gain. So you should be able to really answer a question if a patient comes and asks you. Suppose one of your family members have a problem, you should be able to solve it easily. And that comes from only listening to lectures, because it's a cooked food. Okay, and don't try to open any other textbook. If you're Googling, actually last batch, one girl, I still remember, there was a vaccination, which I told 100 times in the class, this is a passive vaccination. It's not a live vaccine, it's a dead vaccine. 100 times in the class, literally I'm saying 100 times. Mocks also there. And then suddenly a question comes in the group discussion, and she was saying, I just Googled and they are saying the vaccine is live vaccine. Who is saying it's live vaccine? Google. But do you know, like if you have symptoms like cough and cold, Google can diagnose you like for something else. I'm not like telling not to refer or not to Google anything. I'm so sorry, but not about the preparation, not for the patient care. You need a clinician to teach you, and you need a clinical expertise to answer the questions. You don't go by just searching the information. You have to understand it. And for that, please rely on lectures. So how you going to study, how you're going to pass the exam, how many hours you're going to study, I don't care. You finish all the lectures at least 3 times. First time, normal speed, understand. Second and third time, higher speed. Don't do any notes making. Just listen, understand. You'll have fun understanding things, and then do the mock test. You will clear the exam in the first attempt. Okay, so when you have everything raw, then you have to make an effort. But when you have everything cooked and ready, of course, you should trust us. And so did all these students have trusted us, and so they are happy now. So you will also be happy. Just blindly follow what we say. And what we are saying, why we are saying, because we are saying from the genuine sources. We don't refer just Google for any clinical decision or any information. We have thousands of references which we use, which are very standard around the world, proved with research and evidence, and that's where we teach you from. Okay, no dilution. So any question, suppose randomly a student comes and asks me a question, which is not even a question, improperly framed question, and she asks me, ma'am, can you please tell me the answer approximately, please? I would say no wrong answers. Okay, mostly 99% we try to be as accurate as possible. Human error is always there, but mostly you'll have very good accuracy when it comes to preparation. You don't need to worry about it. Yes, so the mocks are mixed, and you are bachelors, you're all pharmacists, you're also mixed. Do any mock randomly, you will answer. Somehow you will have a guesswork and you will answer. Let that conscience work for you, and slowly your subconscious knowledge starts changing when you listen to the lessons, and slowly you will have good layers of good practical knowledge, and then slowly you will see your scores will go from 5 marks to 100 marks in mock test. And slowly you will see you're learning so much, and slowly you will see in 3.5 months from now, you'll have a knowledge equal to a physician when it comes to primary health and patient care. So for example, if I say quote an incident where it's a real life incident. So there was a case which happened. Of course, there is like a near miss cases, and all the cases which are good learning for us when it comes to pharmacy practice, because we deal with patients, human beings, we are not dealing with machines, so we have to be very careful. So accidentally, a technician has packed methotrexate, which is used for rheumatoid arthritis, okay, psoriatic arthritis. It is used for as an immunomodulator, okay, in some cases of leukemia also as an adjuvant therapy, they kind of use it for some patient management. And ectopic pregnancy. So what is ectopic pregnancy? Is normally when moms get pregnant, the fetus, the embryo has to implant in her uterus, which is a house for the baby to live in. But she goes in the baby, I mean, it's not even a baby, it's just an embryo, goes and implants in sometimes fallopian tubes, sometimes near the ovaries or sometimes near the cervix. Okay, and it makes it very dangerous for the mother. So we have to terminate such kind of pregnancies very early. So for that, we give methotrexate, which is teratogenic, which can kill the fetus. And so if I ask you a question, can a pregnant woman take methotrexate? A normal, healthy pregnant woman can take methotrexate? If I'm telling you the information that it is used to terminate pregnancy, you easily tell that it should not be taken by a pregnant woman. Suppose if you read a book saying methotrexate not safe in pregnancy, methotrexate not safe in pregnancy, and then you'll have 10 other drugs added to it which are not safe in pregnancy, how many drugs will you remember like this? But if you really understand what is methotrexate used for in the real life application, you can easily say, sorry, ma'am, we can't use it in healthy pregnancy. It's for ectopic pregnancy. Okay, this is the way you learn. So when you use methotrexate for ectopic pregnancy, it kind of terminates the embryo, like, demise, like it happens, like we just kind of see the HCG levels, that human chorionic gonadotropin hormone levels, if they're increasing or decreasing, and kind of like rationalize treatment and try to save the life of the mother because it's life-threatening for her. So, so the same methotrexate. A lot of patients in Australia, you find them on methotrexate. Okay, and when they come to you, like here, there's a situation where you normally have Webster packs, like daily Webster packs, morning medication, afternoon medication, evening, night medications packed in a pack by the technician. And normally a community pharmacist will check this Webster pack and give it to the patient. And the patient blindly believes the pharmacist and takes the medications from the pack, not even reading the labels properly, because he knows that, okay, the pharmacist has packed it, he has checked it. These are my morning medications, these are my afternoon, and these are my evening and night medications. So once there was a case where methotrexate was not packed, normally it should be taken once a week, okay, but it was packed every day, Monday to Friday or Monday to Sunday. And there was a human error involved. The clinician couldn't identify that, and then it was given to a patient, and the patient got admitted to the hospital. Okay, so this is a near miss. The patient didn't die, but there's a very high chance of patient going into methotrexate overdose, toxicity, and death could have easily happened in this case. So you learn from this case that methotrexate should be given how many times a day?
Once a week.
Once a week. Okay. So let's answer this question. I'll show you a mock question. Let me share my screen. So let's see, based on what knowledge you have, how you'll answer this question. Once again, sorry. Not that one, I'll show the other one. So let's answer this question. Let's see what you'll answer. Well, if you can send messages here, I'm having a look. Ashish, Ria, Angel, Vivek, Keshav, can you see your answer again, dear? Shajani, Iram, Nishat, Prashanti, check your answer again, dear. Then Sarogai, can you check your answer again? Summer, good job. You don't have to be correct, you just answer, don't worry. There'll be a time very soon coming where you'll be answering all the questions correctly, don't worry. So easily, from what I said, is the A option correct or wrong?
Wrong.
Because methotrexate should be taken once a week. What happens if a patient takes it every day?
Overdose can be happen.
Toxicity and even death can happen. Okay, so A is wrong. Easily, based on the incident which I've quoted you, you learned that A is wrong. Okay, what happened when the methotrexate was packed every day? Okay, so the second option, if you miss, suppose Monday to Monday, okay, so Monday, if a patient is on methotrexate every Monday, if he misses a dose on Monday, can he take 2 doses on the next Monday?
No.
No. So easily you can eliminate that because it's methotrexate. B is wrong. So as a pharmacist, you need to know how to counsel the patients about the missed doses, because missed doses is very common. Patients do forget taking medications and they ask you, I missed this dose, what should I do? You get a phone call, like at least in a day, 10 phone calls you'll get. I put this medication outside the fridge. Can I use it? I missed this dose. What should I do? Okay. This medication I took in the traveling, but it was not stored in a good condition. What should I do? Or my son has vomited the medication. What can I do? Should I give it again? Okay, such questions keep coming. If they tell you my son vomited methotrexate, you don't tell them to give it again, isn't it? Right? So you need to know from real life examples how to answer the questions. It's not just about the exam. You need to answer their questions. You're helping them. So B is clearly wrong. Of course, C is something which you need more understanding about folate metabolism. You will have that discussion in your classes. Coughing and wheezing. So leaving it aside, methotrexate can cause adverse effects. It's a myelosuppressive drug, means it suppresses your immune system, your patient's immune system. It's an immunomodulator, so it can cause adverse effects. And to manage the side effects, we need to take another medication called folic acid. Okay, folic acid supplementation is needed because methotrexate is basically an anti-folate drug. Okay, so this is the way you learn. Okay, you learn from the examples which we quote you, and the examples do come in a different way in the exam. They're testing your knowledge, but that comes from understanding the examples, real life examples, which we see in our daily life, which we quote, and then trying to remember that and integrating that, like going a bit more intricated in those details and integrating that knowledge into your practice, into your answering questions. This is a strategy you got to follow. Okay, don't read textbooks. You have finished your bachelor's. No one is going to assess your percentage here. I don't care if you have 90% or 100%. If your distinction, nothing. You're able to help and catch an interaction or not. Are you able to catch a side effect? Are you able to save a life? This is what you learn with us from Elite Expertise. And this is what we expect. And this is what we make sure you learn. And really, if you pass the exam, making sure you safely practice the profession. Yeah, so that's the goal. Okay, just enjoy. Don't memorize anything. Suppose a concept like weekly methotrexate, you don't have to memorize. You don't have to study 100 times. You will remember this example forever. Okay, so learn from the depictions, learn from the demonstrations, and please stick to the teachings. Never go beyond what we teach. So to summarize, lessons, mock tests, nothing beyond what we teach. What your friend is studying, what others are studying, no, nothing. Just stick to what we are teaching. And you have a very good team here, WhatsApp group of other students, just like you, all working professionals, pharmacists here. Have a good rapport, good communication. All of us become family. We are there in the WhatsApp group to support you. If your question is genuine, it will be answered in the class. Don't worry if it's useful. And you have a technical team at Elite Expertise. Any issues with the app, you can tag them at any time. We'll try to be as quick as possible the team is working across the different time zones, but we always make sure we help and serve the students properly, handling patients. So yes, exam is only MCQ based. Yes, and there's no negative marking. So they've included patient care and therapy, and they're giving more weightage in OPRA, which is really good because it's more related to application rather than just memory. So, and you've got a good team. You can escalate any issues, anything, you can put it in your WhatsApp group where you have other students with you. 120 questions in a paper. So no, those are the introductory questions. They don't have any weightage, just for practice, but you have to finish the exam solving all the questions and submit it. And then depending on how you perform, you'll be considered pass. Mostly you'll be passed. Don't worry. Don't worry, start preparing and start doing the mock tests. You have access to ProProfs. Don't worry, even if you don't know any answer, that's fine. And start listening to the lectures. So we'll have very soon, after this orientation session, very soon we'll announce the first lecture, and then we'll be dealing with autonomic pharmacology, the basics. So please listen it. After cracking exam, what's the process to get an internship? You're in Brisbane. So after cracking the exam, you've got to finish your PTE and then apply for a provisional license with APRA. And then you have to search for an internship and start practicing as an intern pharmacist. It's a paid internship, approximately $30 would be the pay. And yeah, this is the nearest pathway to become a pharmacist. And someone's saying, sorry for asking silly questions. Where's the question? Silly question going. Yeah, we don't need to refer our B.Pharm syllabus again. Don't touch any book. Okay, you will not have any time to do that. Don't worry, we'll suffocate you with classes, so you won't have time. We won't leave you. You'll be saying you'll have very frequent classes. Initially, you'll have less frequency, but when you progress to the exam, day and night, like I sit at the morning, 10 o'clock with a green tea, and then at night I finish at 10 o'clock. Same with sir. So you'll be with one of us all the time, teaching. Okay, no time to study B.Pharmacy now. You've studied B.Pharmacy, I hope so. So, any other questions? Pharmacy syllabus. Just listen to the classes, okay? Do we get job as intern only in retail or community? Only community or hospital or retail, depends on your luck. But mostly community is more awarding and nature when it comes to internship, because the intern exams are more community based. And you can even try for hospitals in future. Don't worry about your pharmacy syllabus. Chuck it in the bin now and just focus on cracking the exam and learning patient care. So the classes would be around 3 classes. Each class would be minimum 2 hours. And then in a batch, you'll have 100 lectures to finish the November exam. And you'll have 8-hour classes, 10-hour classes also, depending on when you get closer to the exam. So 100 classes, I would say overall. But to start with, you'll have less frequency, just because we have to go slow initially to make you understand the concepts. Don't worry, Ria. If you're not sure about the November exam, start as if you're going for November. Don't worry, you will do it in November. But if you want any personal advice, we can do it later. How much time will it take to prepare for intern and oral exam? As intern takes 9 to 10 months. So we do have an intern training program with elite expertise. I mean, for your exams help, it is you have official Pharma Guild training programs and all that, which are compulsory. And our program is designed for you to help clear the exam. And I think we have got 100+ interns who have cleared from us. So internship is 1575 hours. And you have to give 2 more exams in your internship. Don't worry about it now. Start studying for OPRA. You'll reach that stage. Need to book exam. Yes, you have a time slot when it books. We will let you know in the group. Everyone keeps booking, so don't worry. I think we've just closed the July session. So very soon the window will open on your portal app, APC portal. Skills assessment would be 2 to 4 weeks, they say. But if your documentation is good, sometimes it is earlier. Kavya. I think I will leave and let Sir take the question and answer session. Okay, thank you, guys. Ritesh, finish OPRA exam. Oral exam, don't worry about it. You will pass. Okay. How come all our students passed? Okay, so you are nothing like, you will be okay. Don't get scared about the oral exam right now. You're thinking way beyond. Take the first initiative. You'll be fine. Okay, guys. Thank you. You'll be fine, Ritesh. I promise. 100% you'll be fine. You've got the good teachers. Okay, I'm not boasting, but I'm really good teacher. I know that. Okay. Okay, guys. I'm leaving now. Letting Arief sir take over. I'll just mute and close the video. Bye bye. Take care.
Yeah, that's all from Harika ma'am, guys. If you have any questions, the chat box is open, and we'll also have Arief sir. We'll pick top 5 questions, so can answer them. If you have any quick questions, the outsiders and the insiders, just ping them. We are there to answer the questions. I guess there are no questions, right? Maybe we can close the session for today. You're welcome, Ashia. What is the PET score we need to update? The minimum would be 66 plus in all the modules, but they say minimum it's good if you have a highest premium score. How many attempts are there? There are n number of attempts, but good to save your money, pass the exam in first attempt. So we have top 3 questions. After this, we can just close the orientation session because tomorrow we have another intern oral session as well. So, sir, am I audible?
Yeah, you are audible. You are audible.
Sir, do you think the below average student can crack OPRA exam?
Yeah, everyone, they can clear the OPRA exam, so need not to worry. If you follow our instructions, okay,
Yeah.
if you follow whatever be the things that we teach, and if you follow the instructions, then 100% you will pass the examination.
How much AI?
So there were.
Yeah, sorry.
So there are many even if you look at the last 3 years of record, so there were many students, like they have got more than 10 years, 15 years, 20 years, 30 years, 30 years of study gap. Okay, even they cleared the examination with the light expertise. So you guys need not to worry much about these things.
So how much AI are we using?
We never use the AI. We use only the human brain here at Elite Expertise. We never touch the AI, because we know that like it is mainly, if it is run by the AI, then what's the use of this world? Okay, what's the use of all the top doctors and everyone here? Okay, so we never use the AI, but we mainly use our own knowledge. Okay, what are the things that we learn in the hospital? Okay, every day when we go to the workplace, so we come across different tasks, we come across different things. So what are the things that we learn at the hospital? The same thing that we teach to the students in the classes. Evening when we come back from the work, the same thing that we keep on teaching to the students. So here, one thing, like most of the candidates, they might be worried that like why we are still working in the hospitals, okay, and doing this teaching and so on. Okay, so it is much important for any teaching faculty, okay, if they are real teachers, okay, so they have to gain the real life experience. So without getting the real life experience, they can't become a teacher in the world. Okay, so they can't teach something just by reading the books and so on. So that's the main reason why we still keep on working in the hospital. We'll go like for myself, I need to wake up early in the morning at 5:30. Then I need to get ready and I need to drive for 1 hour and I need to go to the hospital because my hospital from where I'm staying is 1 hour away from the. It is
Yes.
40 kilometers, and driving in the Melbourne city it takes like more than 1 hour time for me to reach there. But still, I'm doing all those things. The reason is because I want to put myself updated with the knowledge. Okay, I want to put myself in the practice. Okay, if I don't practice, then we are
Nothing.
not a
Yeah.
teachers. Okay, we will never become a teacher unless we keep on learning every day. Okay, so that's the most important thing that I would
I
like
guess
to share.
there is a huge difference between mentor and a teacher, sir. I feel like, yeah.
Exactly, yeah. So here, what we are doing is we are doing both the mentorship as well as teaching to
Teachers.
the
Yeah.
students.
So Kapil is asking, but all the questions will be generated by AI. How did you get to know about that, Kapil? Like every question will be generated by AI? Isn't it,
Which
sir?
questions?
I don't
Like
know.
here at Elite Expertise mocks and Elite Expertise questions that you are
No.
telling, Kapil?
We are not that pros to use all those. Yeah. Sir, the other question which we got, the last question, New Zealand OPRA exam and the Australian OPRA exam both the same, right, sir? Only the skill assessment.
Yeah, they both are same.
The,
So for New Zealand and for New Zealand OPRA and for Kapil is saying OPRA questions. OPRA in the sense the real OPRA exam, which is
yeah, maybe
conducted
he's
by the
quoting
APC.
that. Yeah.
No, Kapil, don't think that. So, like, whoever is passing such a false message, okay, so that's completely incorrect. It is not AI who designs the question paper in the APC, because even APC has officially released video on it. Okay, so APC has officially released a video, and that video is available on YouTube. Okay, so just watch that video. So APC has clearly mentioned that they never use any AI tools, okay, for preparing the question papers or setting the questions in the examination. Okay, so if some of the institutes, if they are telling that we follow the AI because everywhere it is AI, even the examination they are following the AI. Okay, so that's absolutely false claims that they are making. Okay, so following AI is not a. Yes, AI is one of the helpful tool for us. Okay, but we should never depend on the AI.
Correct. Yeah, sir, that's all from our side. Thank you so much, sir. Yeah. Having 10 years of gap. Ansari.
Oh, like recently we have released the video of what's her name? Janet. Yeah.
Yes.
Janet.
Yeah.
Janet is 60 years old and she passed the exam, OPRA exam
Video
with
is yet
us.
to be released, sir. Even
Yeah, video is yet to be.
Yeah. Having has a long career gap with the studies and all.
Yeah. Even last year in 2024 March batch, we have Mr. Raju Patel. So Raju, I will share you his background because it's really inspiring thing. So his age was 66 years. Okay, his age is 66 years. Okay, so at the age of 66 years, he called me and he spoke to me and he asked me that Arief, is it possible, like can I do this exam, OPRA exam, because my age is 66 years, because the only reason why he want to sit for the exam is his son and daughter, they all got settled here in Australia, so that's why he want to move from India to Australia, and he wants to, but again at that age everyone, all they think that okay, we'll move there and we'll get retired and we'll just spend the time with our kids, but his like way of thinking was completely different. He still wants to work. Okay, so and he did his Bachelor of Pharmacy back in, it was 1980s. Even I haven't burned like all who are here, we haven't burned at that time. So by that time, long ago, he cleared his Bachelor of Pharmacy, and he's not also practicing as a pharmacist. Okay, he was working in the industry. pharma company industry. And he contacted me, he called me and he spoke to me. I had a chat with him, conversation with him on telephone, and he asked me that what is the procedure and so on. I explained him, if you spend strictly 3 months time with me, okay, so you should keep everything aside and spend 3 months time with me, and I will give you the guarantee that you will crack this examination. So he did the same thing and he passed that examination in his first attempt. By the time it was KAPS, like paper 1 and paper 2, he cleared both the papers, paper 1 and 2, in his first attempt.
Yes, that's so inspiring. Thank you so much, Arief sir, for all your time, efforts, patience, and your mentorship. I hope all our student wishes come true. And I feel the July result, I guess we'll be getting within 3 weeks. We'll have a great,
Exactly, yeah.
that day also we'll have a very nice session. Live session, I believe. Isn't it, sir? We'll have a live session on that same day.
Yeah, of course.
Yeah, about the success stories. I feel all the success stories will be there in November batch as well. May God bless you with all the happiness. Good luck to everyone, guys. This is from me, and last few words from Arief sir.
Yeah, I would like to thank all the participants for attending this orientation session, and even those who are outside from Elite Expertise, those who are watching this live session or attended this session, joined this session. So, well, like as I mentioned, the preparation plan, okay, so we need to go accordingly, and we need to, our main goal is to crack this examination in the first attempt, okay?
Yes.
So, yeah, thank you so much and see you soon in the live class.
Yeah, there is no plan A, plan B, there is only plan E. That is Elite Expertise, guys. Don't forget. So, all the very best. Bye bye, guys. Take care. Signing off. This is Ashita. Bye bye. Bye, Arief sir.
Bye. Thank you, guys. Thank you so much.